Okay, this video is the new Peter Rogers theory of cancer. And basically, there's a lot of things that contribute to causing cancer. And I just figured out a new one. This is actually a big discovery, but you'll never find this in any book. I just figured this out. And wait till you see this. This is an academic orgasm. It's beautiful. All right, so this is a quick summary slide. I've actually got a bunch more slides, but I'm just going to show this one right at the beginning. For some people don't have a lot of time. Other people have short attention spans. And then the later slides are going to explain how this all works and why it's true. Okay, so first of all, somatic mutation theory, SMT, is what the conventional textbooks go by. The idea that, here's your normal cell. It's got DNA in the nucleus. It's got a mitochondria over here, plasma membrane on the outside. Some type of toxin injures the cell, damages the DNA, causes a change in the DNA, a mutation, and cancer occurs. And by the way, that's largely been disproven, but all of conventional medicine goes by that. The somatic mutation theory, I say it's largely been disproven because of the Genome Atlas project, which showed there wasn't a consistent, predictable pattern of mutations, hardly ever. So it sometimes is relevant, but it's mostly not. All right, so the next thing that comes along is the MTC, the metabolic theory of cancer. And you typically think of it as being called the Warburg effect, named after Otto Warburg, whereby working with human tissue cultures, he showed that if you cause hypoxia, like let's say more than 35%, you will potentially injure the mitochondria, and the cell will have to revert to primarily anaerobic metabolism, like running glycolysis. That's why cancer cells take up more glucose on a PET scan, 100 times more than a regular cell, typically. And this hypoxia running on an anaerobic metabolism kind of changes the cell from being a normal human functional cell within an organ, let's say the liver, the lung, or whatever, to now behaving like a bacteria, an anaerobic bacteria that just wants to grow rapidly, to proliferate and divide and spread to other locations. And that's cancer. Okay, so that's what cancer is, a cell that doesn't do its job within an organ system, and it just tries to replicate until it replicates and spreads and kills the patient. All right, tobacco induces hypoxia. Smoking cigarettes can do more than one thing. It'll also have toxins, benzopyrene and other toxins, but it'll also cause hypoxia. So anyways, high-fat diet will cause about 15% hypoxia to the tissues, 15 to 20% based on the work of Peter Quo. Sodium is a vasoconstrictor. That'll also cause some vasoconstriction to contribute to this hypoxia effect. And that's sort of the hypoxia-induced mitochondrial injury. The mitochondria are injured hypoxia because they need oxygen to run oxidative phosphorylation. Oxygen is the ultimate acceptor of those electrons passed down the electron transport chain on the inner mitochondrial membrane. Okay, so you got that basic stuff. You need to know the Warburg effect. It's the foundation of the metabolic theory of cancer. But what I'm going to explain, and it's going to just totally make sense, when you have hypertension and diabetes, they cause atherosclerosis. Atherosclerosis is just a blood clot. A blood clot in the artery wall causes scarring in the arterial wall as it organizes and gets partially reabsorbed and whatnot, and that decreases oxygen delivery to the tissue. Hypoxia, mitochondrial injury, Warburg effect, cancer. Okay, see how that works? Infection. You get an infection, like let's say in the liver, HBV, hepatitis B virus. It could be hepatitis C virus. It could be other liver infections or inflammation. They cause inflammation, which means the acute early phase of the immune response. Lots of white blood cells, all kinds of macrophages, neutrophils, ongoing destruction and stuff. But then when it cools off, you have scarring, collagen, fibrosis. Fibrosis of the liver is cirrhosis. You trap some normal cells into the scarring, and some of those are, of course, experience hypoxia, cancer. So hepatitis B leading to liver cirrhosis, leading to cancer. Okay, and it works for a whole bunch of other things. You can have NAFL, non-alcohol fatty liver, leads to non-alcohol steatohepatitis. NASH causes scarring, hypoxia, cancer. You have the same thing in the pancreas, non-alcohol fatty pancreas. It becomes steatopancreatitis with inflammation, scarring, hypoxia, cancer. So what I'm showing you is there's a standard projection of events, sequence of events leading to cancer. Inhaled foreign body into the lungs like asbestos. Foreign body reaction by the immune system around the asbestos particle walled off next to the pleural space. You can get subsequent, the collagen forms a scar, hypoxia of some lung cells trapped in the scar, Warburg effect, cancer. All right, so I'm showing you how this all works because once you understand the mechanism, like all the conventional medical books, they almost never tell you how anything's caused. But it's the most important thing you could know is how something is caused. Because once you know the cause, almost always avoiding the cause helps to slow down the progression. It's part of a useful treatment. In the esophagus, you got gastroesophageal reflux. First of all, you don't eat dietary fiber. You get abdominal pressure syndrome. The stomach pops into the chest a little bit. Hiatal hernia, that's called. You get gastroesophageal reflux, gastroesophageal stomach acid, causes inflammation of the esophageal wall. The healing response leads to something called Barrett's esophagus, scarring, inflammation, hypoxia, Warburg effect, cancer. Okay, mitochondrial injury, cancer. Okay, now the other thing, there's other things that contribute to it. You know, of course, let's say estrogenic chemicals stimulate breast ductal cells to proliferate, and that increases the risk of excessive proliferation, cancer. The estrogenic chemicals do the same thing in the prostate, same thing in the uterus, okay? So those would be examples of hormonal cancer, stimulating proliferation. Things that suppress the immune system increase the risk of cancer. High-fat meals, being obese, from fatty acid spillover into the blood with obesity. Stress, sleep deprivation, caffeine, they all do the same thing. Increase cortisol, suppress the immune system. Immune system can no longer remove cancer, increase cancer. All right. Okay, so now, what has this all been leading up to? Well, if the reason for the Warburg effect is mitochondrial injury due to hypoxia classically, for all these reasons, well, what did I just talk about recently? I've been reading about what causes brain damage and cognitive impairment and dementia. And then I went through all my biochem books because I knew there had to be more of a mitochondrial injury mechanism than was being put forth in all the books and all the lectures I'd heard. So I started, and I couldn't find, I own about 7 biochemistry textbooks. I couldn't find anything on mitochondrial inhibitors in all my textbooks. So I started going through the literature, and I quickly found over 50 mitochondrial inhibitors, and many of them are very common. Antidepressant medications, selective serotonin reuptake inhibitors, diabetes treatment with metformin, okay, glyphosate, sprayed on non-organic soy, a whole bunch more, lead, arsenic, HG, there were tons of them. The fungal inhibitors are mold inhibitors put in processed food so it doesn't grow mold, doesn't get returned to the company. There's tons of that in processed food. They often are mitochondria inhibitors. Propofol, mitochondria inhibitor. Tylenol, mitochondrial inhibitor. Aminoglycosides, mitochondrial inhibitor. Fluoroquinolone, mitochondrial inhibitor. Beta-lactam penicillins, mitochondrial inhibitor. It goes on, and these are common things. So what I'm saying is, death by 1,000 cuts, nickel and diming, trashing mitochondria, and I believe this is contributing to increased incidence of cancer. So then at the end of all this, you say, okay, well, what does that mean? What do we do? Well, eat a low-fat diet, preferably very low-fat, less than 10%. Avoid unnecessary dietary sodium. Avoid the processed food. Avoid fungal inhibitors. Avoid your processed food. Avoid the other mitochondrial inhibitors if possible, like I just talked about. So what I'm doing is I'm giving another way to reduce one's risk of cancer acquisition and cancer progression. So anyways, I thought that was pretty cool. That's an AO, an academic orgasm. That's fucking beautiful. Okay, so now I'm going to go through some more slides. Here is Otto Warburg. Otto Warburg was a German biochemist, considered by many the best biochemist of the 1900s. He trained Walter Kempner, considered by many the greatest doctor until Dr. McDougall's era. Okay, Hans Krebs discovered Krebs cycle, discovered the urea cycle. Those are his students, Otto Warburg's students. And so here's the gist of the Warburg effect. We just talked about it. You get injury to the mitochondria, and it can no longer make much energy from its mitochondria, so it starts running primarily on glycolysis. And there's more to it than that, but that's all you need to know. So here's the Warburg effect. You're primarily burning glucose anaerobically. Okay. An overview of cancer, just the gist of cancer is that basically hypoxia, this is the metabolic theory of cancer. Hypoxia causes injury to the mitochondria. You get initiation of tumor. Tumor starts. Here's the somatic mutation theory. Some mutagenic toxic chemical or a virus damages DNA, and then that's initiation. Then the tumor grows. That's called tumor promotion. These are things that will increase that. Then the tumor metastasizes, and that's what kills the patient. They usually don't die from the primary tumor, other than a brain tumor. Most primary tumors don't kill the patient. Brain tumors are super rare. Okay, here's a little bit more supportive information for the metabolic theory. This is from the book Thomas Seyfried, and it's from his lectures, Cancer as a Metabolic Disease. And he basically showed, the guy did some great research, and he shows that, injury to the mitochondria and abnormal cell cytoplasm is what's causing cancer. It's not the problem with the DNA and the nucleus. That's an important point. Okay, that fits with the metabolic theory of cancer. And here's what I was referring to earlier. So here's a normal capillary. Red blood cells pass through. RBC is a little bigger than a capillary. RBC is about 7 microns. Capillary is about, so RBC is about 7 microns. You need to know that. Capillary is about 5 microns. So it has to deform on itself, fold back on itself to pass through the capillary. Little blue circles are the oxygen being given off, and they go to the tissue. For example, in this drawing, I have a neuron here. All right, well, when you get diabetes, you get thickening of the capillary basement membrane. This yellow thing is the capillary basement membrane right here. All right, the green stuff is the vascular smooth muscle. You get diabetes, you get hypertrophy of the capillary basement membrane. Well, the thicker it gets, the harder it is to deliver oxygen to the tissue. You also get hypertrophy of the vascular smooth muscle around the artery, around the capillary. There's not much around capillaries, but it's still contributing to thickening of the wall and collagen being laid down and scarring. Going to decrease oxygen delivery to the tissue. That contributes to hypoxia over time. Patients with diabetes, hypertension, they get increased risk of cancer. Okay. One point too I'll make is, you had these real heavy smokers in Papua New Guinea, smoking like chimneys. And also in Japan, smoking like chimneys, but they're eating very low-fat diets. Papua New Guinea was eating over about 93% of their calories from sweet potatoes, which is 1% calories from fat. The Japanese were eating tons and tons of rice back in the 1960s, which has only 1% of its calories from fat. So the point being is, despite the fact Papua New Guinea and Japan were smoking like chimneys, in Papua New Guinea, for example, they had over 6 times less lung cancer than Americans. The Japanese had dramatically less lung cancer than the Americans as well. And what I'm saying is it's because of the high-fat diets. They're not getting as much hypoxia, even though they smoked even more than the Americans. That's pretty interesting, okay? Now, here's some work. This was done by Roy Swank. He's the great neurologist who figured out how to improve outcomes with multiple sclerosis. He started out in Canada, went to Oregon. When he's in Oregon, he became friends with Dr. McDougall. They did some work together. And there's a video. If you go to Dr. McDougall's YouTube channel, it's Dr. McDougall's Health and Medical Center, they'll show, it's only 50 seconds long, this video, normal blood flow, when the patient's in a fasting phase. And then after they eat a high-fat meal, the red blood cell starts clumping together, sticking together. That's called blood sludge. It's also called rouleau formation. It means a stack of coins in French. And then when the RBCs are all stuck together, they can't deliver oxygen as effectively. Typically, it's about a 15 to 20% drop in oxygen delivery. More hypoxia, increased risk of cancer. Okay. Here is some of the research done by Peter Quo. He was a cardiologist in Pennsylvania. He checked the blood lipids on the patients every 30 minutes after feeding them a high-fat meal, initially with saturated fat. And he found between about 4 to 7 hours at peak lipemia, highest lipids levels in the blood, the patients would get chest pain. These patients all had baseline cardiac angina, meaning heart disease, coronary artery atherosclerosis-related chest pain. And it totally correlated with the lipemia in their blood. Later on, Meyer Friedman and Ray Rosenman, two ophthalmologists, repeated his experiments in the 1960s when people thought that, PUFAs, polyunsaturated fatty acids, the cooking oils, might be a good replacement for the previous saturated fats eaten by people in the 1950s, like, let's say, butter. And Ansel Keys had shown that sat fat was definitely a big cardiac risk factor. So anyways, they did it with the PUFAs, the omega-6 cooking oils, and it was even worse, even more prolonged blood sludging. It was blood sludging so long the workers wanted to go home. They were pissed off in their laboratories. Okay, and they also looked at it on the eyes with an 80-fold magnification. And here's a quote by Dr. McDougall. When safflower oil is used, the sludging of blood was worse and lasted longer than with sat fat. Yep. Fat is not good for arteries. Okay, all fat ends up being a problem for arteries. We're not made to eat high-fat diets. Okay, so that was what I was just showing. I showed you the hypoxia caused by that. I also mentioned the high-fat diets and the stress causing immune suppression, making everything worse. Okay. Now, here's one little minor thing people don't know. You got to eat your fiber. When you eat fiber, the good bacteria take it. They make short-chain fatty acids like butyrate. The intestinal lining cells, intestinal epithelial cells are called. They're also called enterocytes. They use those to make TJs. TJs are tight junction. That prevents leaky gut. If you don't get your dietary fiber, or if you are exposed routinely to any of these toxins there's like about 30 of them. These are all the things you should avoid if you have autoimmune disease, or everybody should avoid them. I avoid all of them as best I can. Anyways, when you get leaky gut, increased intestinal permeability because of the lack of fiber, let's say in particular, causing breakdown of the tight junctions, you'll get LPS, bacterial endotoxin. Also, there's another bacterial endotoxin called LTA. They get through the gap in the intestinal barrier, and they get into the blood, and they cause the blood to be more prone to clotting. So here's just another diagram of it. Gram-negative bacteria, LPS endotoxin, gram-positive bacteria, LTA endotoxin. They get into the blood, and they cause the fibrinogen, it's a clotting protein, to change from an alpha helix configuration. So you got an alpha helix configuration normally, and they change it to flatten out into a beta pleated sheet. The problem with the beta pleated sheets is, the alpha helices, they don't stick together well, but the beta pleated sheets will stick together. You'll form these giant precipitates out of aqueous solution. They're clots. I call them dense matted deposits, and they're hard for the body to dissolve. Excessive free iron in the blood due to excessive iron ingestion over the years, over decades, can also cause a similar effect due to autocatalytic ferrous redox cycling. I know you used a couple fancy words there, but the bottom line is you don't want to be iron overloaded. The bottom line is you don't want leaky gut. They make your blood more prone to clotting. Infections can do that. Viral infections can do that too. Okay, here's a different type of situation with regard to infection. This is a liver, and if you accumulate fat in it, fatty liver, and I can tell you the majority of Americans over 50 have fatty liver. It's super common. I see it even in much younger patients quite commonly. And NAFL is non-alcoholic fatty liver. When it becomes inflamed over time, it becomes NASH, non-alcoholic steatohepatitis. The reason why they call it non-alcoholic is in the past, most fatty liver was due to alcoholism. Okay, now it's mostly due to these lousy SAD diets, standard American diet. Well, over time, this progressive scarring and inflammation leads to scarring, fibrosis, that leads to cirrhosis, which means end-stage scarring of the liver, and that traps some cells in it that become hypoxic, and they get cancer. So that's how infection and inflammation lead to cancer. And here's the same thing. You inhale asbestos fibers. It used to be used for insulation, and the workers would inhale asbestos fibers. The immune system mounts a response to it, foreign body reaction. They form a bunch of fibrotic tissue around it and trap some normal cells in there, and those will become cancer. So it's the same thing about inflammation, always leads to fibrosis, some fibrosis, and then that leads to some hypoxia and can lead to cancer. Okay. And then here is just a paper showing the same thing happens in the pancreas. Non-alcohol fatty pancreas, which you get from all these high-fat diets, you start seeing, normally the pancreas should look more like the pancreatic tail right here. Here's the pancreatic neck region. You see how there's a lot of this low-density stuff? That is from fatty replacement of the pancreas. And by the way, on a CAT scan, the liver should always be denser than the spleen. In this patient, the spleen is much denser than is the liver. That's fatty liver. So fatty liver usually occurs first, and then you start accumulating fat in the pancreas, and that's bad because that damages the beta cells, the islet cells that make insulin. So it also leads to diabetes. But the reason I showed it here was that the accumulation of fat in the pancreas goes from just being a fatty pancreas to becoming inflamed, non-alcoholic steatopancreatitis. That leads to scarring, fibrosis, and then increased risk of pancreatic carcinoma. So I'm giving you a standard mechanism to understand cancer causation. And that's a beautiful thing, because what you're typically told by conventional medicine is, you're screwed, there's nothing you could do, take our chemo, good luck, make a will, okay? And what I'm basically saying is, once you understand these, you could say, well, gee, I'm going to avoid everything that causes hypoxia on my pancreas, okay? Or my whatever organ system it is, whatever causes inflammation in my organ system. I'm going to avoid everything that suppresses the immune system. This is what I would do, okay? So you're not just helpless. If you educate yourself and use your brain, there's a lot you could do. You don't want to do any of the stuff on here. Avoid the high fat, avoid the high sodium, avoid the tobacco, avoid the things that cause hypertension and diabetes. Avoid the things that tend to cause infection or fatty liver, okay? Avoid the things that cause gastroesophageal reflux. Avoid the things that suppress your immune system. And most importantly, the purpose of this talk, avoid all these mitochondrial inhibitors. I'm going to show all the mitochondrial inhibitors in a slide in just a moment. This was just a slide about the origins of life and the evolution of life on Earth. And the point was, initially, Earth did not have oxygen available. Gradually, photosynthesis became available and oxygen slowly increased in the world. But initially, it was quite low and it was intermittent before stabilizing at the modern 21% of air is. at sea level is oxygen. Okay, so cells had to be able to revert back and forth between oxygen and non-oxygen metabolism. All of your bigger animals all have oxygen metabolism because you can make tons more ATP from a mitochondria than you can from glycolysis. Glycolysis per glucose only produces 2 ATP. When you're able to run the whole cycle through the mitochondria with oxygen, you can produce 36 ATP. So 18 times more energy. That's a lot of energy. Can be obtained when you have mitochondria functioning with oxygen available. Okay, so here's a prokaryote. Karyote means nut, like nucleus. So a prokaryote, like a bacteria, has no nucleus. A eukaryote, like the typical cells in humans and other mammals and whatnot, will have a nucleus with DNA in it. But actually, more importantly, and so euc means true nut, eukaryote means EU means true, karyote means nut, so true nut means true nucleus. But the reality is, the more important thing is it's got mitochondria. Okay, that's really the big important change. All right, regular cell. When anaerobic bacteria runs on anaerobic glycolysis, burns its glucose to pyruvate, then the lactate. A normal human cell uses oxygen through Krebs cycle in the mitochondria, makes tons of ATP because it's a worker. It just has to do a whole bunch of work. That's its job all day long as part of an organ system. Whereas a cancer cell runs typically primarily on anaerobic glycolysis. There's still a little bit of mitochondrial function, but you got a problem with the mitochondria. It starts pumping acid into its surrounding environment, and it just tries to grow like our anaerobic bacteria over here. It no longer functions like a normal human cell. And then the cancer microenvironment, you often call it the cancer milieu, tumor microenvironment, tumor milieu. Basically, it tends to be hypoxic. Let me get myself out of the way. Hypoxic, lack of oxygen, and acidic. And the reason for that is the hypoxia enables the cancer cells to outcompete the surrounding cells of normal tissue. And the acidity in the vicinity of the cancer, and it pumps out protons, acid, as it anaerobically metabolizes the glucose, that turns off the immune system. So the acidity turns off the immune system. That's another reason why eating a plant-based diet, which is much more alkaline than all the sulfur-containing amino acids coming from the meat. You want to do that to favor your normal tissues over your cancer tissues and to help your immune system out. You want your immune system to be able to function optimally so it can remove the cancer. It is your immune system which protects you. Okay, just briefly, normal cell runs its plasma membrane pumps based on ATP. So ATP is adenosine triphosphate, gives up a phosphate, becomes ADP, adenosine diphosphate. But you need to know that. Plasma membrane metabolism to produce an electrical battery-like effect and stored energy comes from ATP and the sodium-potassium pump. Okay? And you're going to need that pump big time. And you're going to need that to generate all these electrochemical gradients so you can pump calcium out of a cell. And then basically in your neurons and other cells, all roads lead to calcium. Calcium is where it's at for understanding metabolism because calcium is the aristocrat. Calcium walks into the cell and it just starts bossing things around. Do this, do this, do this, okay? The sodium, potassium, magnesium, they're like the minimum wage workers. They're just doing their job, keeping their mouth shut, okay? So all roads lead to Rome and all roads lead to calcium. So lots of things increase cytoplasm calcium. And you've got to keep this cytoplasm calcium under control if you want the cell to function correctly. Lots of cells have all these toxins and metabolic problems with their electrolytes leading to high cytoplasm calcium, and the cells are becoming dysfunctional. And it takes tons of energy to pump calcium out of the cell. Where does energy come from? It comes from mitochondria. So what does that mean? It means if your mitochondria is damaged, you don't have enough energy to pump out the calcium, and the cell is screwed. Okay, it becomes dysfunctional, potentially cancerous. All right. So here's showing how you pump calcium out of a cell. You can pump calcium straight out of the cell through this thing right here, PMCA, plasma membrane calcium ATPase. Uses an AP to pump. You always need ATP to pump calcium out because the concentration of calcium outside the cell is like 10,000 to 15,000 times higher than it is inside the cell. Super high. Anytime you're pumping against a gradient, you need ATP energy. So you need ATP energy to run the sodium potassium ATPase, which we spoke about earlier. And then that's coupled to making the NACA exchanger work, Na for natrium, Latin word for sodium, and Ca for calcium, And so that thing spins based on allowing sodium to come back into the cell and pumping calcium out. But the energy for it comes from this pump. And you can also pump into the endoplasmic reticulum. It's called SERCA, the S is for sarcoplasm, which really relates only to the muscle cells. But just know you need to pump. You can pump into a reservoir of storage in the endoplasmic reticulum. But the key point was it's all dependent on ATP, means it's all dependent on mitochondria. And you need these pumps working because these three guys here pumping the water out of their boat has a hole in it. That is all the pumps, and they're all dependent on ATP. So basically, if you destroy the mitochondria, it's like losing these guys to do your pumping, okay? And I know there's a hole in the boat, and the smart thing to do would be fix the hole in the boat, but the cell can't completely do that. There are things you can do that are like fixing the hole in the boat, but you can never completely fix the hole in the boat because the cell does need some calcium coming in. But what I'm trying to say is, if you start wiping out your mitochondria, you're losing all these guys. This boat is going to sink. It's screwed. Neurons in the brain, they die. They go into apoptosis, okay? And what I'm saying is, in order to handle your calcium, you have to have functional mitochondria. That's a really essential point to get. This is just from my theory of dementia. You know, we talked about the best theories of dementia, and mine was neurovascular uncoupling. Basically, you've got a metabolic rate of a neuron, and you need to match oxygen and glucose to it. That's called neurovascular coupling. Coupling of the metabolic rate to the amount of oxygen and glucose. Or the oxygen and glucose delivery has to be increased when the metabolic rate goes up. And that's why you don't want to take a stimulant, because it increases the metabolic rate. And you don't want to do things that are atherogenic, because they block oxygen and glucose delivery. But guess what? You also need ATP production. So if you have a mitochondria inhibitor, you further widen this gap between the metabolic rate and the ability to produce energy based on oxygen and glucose delivery and mitochondrial function. So the neurons are screwed. When the neuron can't meet its metabolic rate to a severe enough amount, the gap gets too big, and for a prolonged amount of time, it goes into apoptosis, programmed cell death. Okay? So what I'm basically saying here, mitochondria are super important, and conventional medicine doesn't understand that, and conventional medicine doesn't know mitochondria inhibitors. Okay, I can tell you what my internal medicine friends say. I'll show you in the chart in just a moment. You know what? I'll say it when I show you the chart because it'll make more sense. But wait till you see it. Okay, here's what a mitochondria looks like. It has an outer mitochondrial membrane, OMM. It has an inner mitochondrial membrane, this green line, that's IMM, inner mitochondrial membrane. The space between the inner and the outer membrane is called the IMS, the intramembranous space. That's where the protons are pumped. The inner center of the mitochondria that's in yellow in this drawing, that's the mitochondrial matrix. That's where Krebs cycle runs. Krebs cycle is the same thing as the tricarboxylic acid cycle. It's the same thing as the citrate cycle or citric acid cycle. Okay. Now, the mitochondria is just brilliant, okay? I believe in God, and I'm proud of the fact I believe in God. And anybody who thinks science should be atheistic, I think you're an idiot, and you can go to some other channel, okay? Because I'll show you how brilliant this is. The inner mitochondrial membrane, it's a genius. Basically what happens in the mitochondria, the hydrogen atom is split, okay? So they figured out how to split the atom a long time ago. And the proton components in the matrix are pumped out into the intramembranous space. That's a H+, that's a proton, that's your acid. Okay, then the electrons are passed down from complex 1 to complex 2, complex 3, complex 4. Actually, complex 2 does something else, but they're basically passed down all the way until complex 4, and then they're handed off to oxygen. Oxygen is the ultimate electron acceptor. So isn't this cool? Hydrogen consists of a proton component and an electron component. And the mitochondria splits the atom and then uses the electrons to generate energy, and that energy is used to pump protons into the intramembranous space, generating a big electrochemical gradient. The gradient in the mitochondria is extraordinary. It's the biggest gradient in the human body. I usually think of it as being about 160 millivolts. It can be anywhere from 150 to 200, but it's super high, okay? And that super high gradient, it's the highest gradient in the human body, is then harvested by allowing a proton to come back into the mitochondrial matrix, and it spins the ATP synthase, and that generates energy to add a phosphate to ADP, adenosine diphosphate, as in 2 phosphates, to become adenosine triphosphate, as in having 3 phosphates. And it's incredible. That's how all life on Earth works. All aerobic life on Earth works on this. All humans, this is our main energy source, okay? Okay, so normally, I just showed you, here's another way to draw electron transport. Coenzyme Q will even normally occasionally drop an electron down onto oxygen in the mitochondrial matrix. You can form a superoxide free radical, but there's a lot of enzymes in the mitochondria to neutralize it real quick. Superoxide dismutase will get that under control real fast, okay? So a small amount of electron leak from the inner mitochondrial membrane is normal. However, it gets worse. Excess dietary fat, especially sat fat, will inhibit this step in electron transport, And now you're going to start dropping more electrons. You're going to start producing more free radicals. And this is when the cell shuts down. It goes into what's called overnutrition, sends a signal out to the cytoplasm and the plasma membrane. Don't send any more glucose type 4 transporters up to the plasma membrane. We can't take in any glucose right now because we are overwhelmed with the nutrients that we have. Fat gets into the cell faster and it inhibits this electron transport. So that's what causes insulin resistance. Excessive dietary fat is the main thing that does it, especially sat fat. Okay, this is just showing that when you have an excessive amounts of electron leak, you overwhelm your neutralization antioxidant abilities, like these enzymes here, superoxide dismutase, catalase, glutathione peroxidase, and it's even worse if you have excessive iron on board, you'll run the Fenton reaction. So anyways, then this can lead to production of hydroxyl radicals, which trash the membrane through a process called lipid peroxidation. So the bottom line is you'll get excessive amounts of oxidative stress, which can destroy the mitochondria if you eat too much fat too often, or you have these other problems in here. So I'm going to show you how this works too if you're iron overloaded. There's other things that inhibit. Some of these I talked about. Glyphosate, we talked about that, sprayed on non-organic soy. Cadmium comes off of brake pads. That's why I won't sit on a crowded street at some outside cafe. I won't do it. Atrazine, sprayed on GMO corn. F- is in your tap water. That's a mitochondria inhibitor. Isn't that great? Cooking oils, omega-6 cooking oils, lead to production of toxic aldehydes like hydroxynonenal, typically abbreviated HNE, that inhibits mitochondria, ATP synthase. Okay, so these are just a couple of really common ones. Lead is a mitochondria inhibitor. Hg is a mitochondria inhibitor. Okay, so we talked about it. If you add the mitochondria inhibitor, you're going to increase the likelihood of having mitochondrial dysfunction, potentially causing cancer. So what I'm saying is there's a synergistic worsening of all these things adding up to cause cancer. All right, so now, like I said, I went and looked in the books and I quickly found over 50 of these things. And look how common these things are. Statins, inhibiting coenzyme Q, selective serotonin reuptake inhibitors, SSRIs, Haldol, MPTP, the thing that causes Parkinson's disease, trichloroethylene, also associated with Parkinson's disease. That's in liquid paper, it's in dry cleaners. That's why I won't go to dry cleaner anymore. It's a degreaser cleaning chemical as well. Tylenol, manganese, like from welding. All these things, I mentioned some of them before, but what I'm trying to say is there's tons of them, and lots of them are common medications. So it's like one of my internal medicine friends says, gosh, conventional medicine is so stupid. We're supposed to be helping these people, and we give them all these medicines that are mitochondria inhibitors, like statins, like antidepressants, like metformin, Lasix, Haldol, propofol, and then the processed Tylenol. The processed foods got all these antifungal mold inhibitors or mitochondria inhibitors. Isn't this great? They used to tell people it's okay to drink alcohol 1 to 3 cups a day. Mitochondria inhibitors. Processed food, all the food dyes associated with mitochondria inhibitors. It goes on and on. Al is in your water. It's in your air. Great. Iron is used to so-called fortified and rich foods and makes them worse. So, all right, get your sunshine. Vitamin D improves your immune system. The sunshine also activates nitric oxide precursors from your subcutaneous tissues to give you more systemic vasodilation. Same old story on the diet. The American SAD diet is for chumps. The Japanese diet was actually pretty good with the rice, but they screwed things up by smoking a lot of cigarettes. And nowadays they also are frying more food, eating more animal food, so their health is deteriorating. The Asian Indian diet, South Asian Indian diet, their problem is, a little bit of ghee and butter, but the big thing from the Indian people I've studied and talked to is too much fried food. That's really the big thing dragging down the health of their diet. Low fat, low sodium, vegan diet. It's low in all the problems. It's the best way to go. Okay. All right, so just summarizing again, all these things are pushing people towards cancer, and then, on top of that, be ingesting mitochondria inhibitors out of ignorance is a big, stupid thing to do. So it's a very avoidable thing. You can avoid all that stuff to a large degree. So that's the end. I thought that was kind of a cool thing. I thought I was real happy that I thought of this because it totally makes sense, if I apply for grant money to publish as a paper, they'll jerk me around. I've tried to publish a lot of stuff as papers, and they won't give me funding. It's hard to get funding for anything that just helps patients but doesn't generate money for a company through selling a drug or advance the conventional paradigm. But anyways, for cancer patients out there, I hope this can help you. Logically, it totally makes sense, so I thought it was interesting. That's it.